Medical marijuana is now legal in the state of Ohio, but the patients who feel they need it can't get it.
Tonight, a 2 News investigation takes a look at the process to make sure legal medical marijuana is rolled out smoothly. Natalie Tyndall talks with people in charge of shaping this new industry.
Well, those patients with certain medical conditions might be waiting more than a year before they can get this drug in Ohio. That's because a new committee must map out every detail from the marijuana seed to the plant's sale. What does the industry look like? Where is the marijuana grown? Who gets to sell it? And when can patients finally buy it? Those are all questions this group of 14 Ohioans is hoping to answer.
We have a lot of people represented.
From pharmacists and physicians to researchers and drug addiction experts, this team will set the rules. 2 News Investigates traveled to Columbus for their first meeting and tracked down the local members. Shelby County Sheriff John Lenhart and Dayton Pain Management physician Dr. Amol Soyan.
But the most important thing is that we do this properly and take the appropriate steps to make sure it's rolled out so that we have patient access coupled with safety for the public.
Job number 1 is to figure out how pot is going to be grown in the state and who would do it. The group recommends 12 large growers and 6 smaller ones for the entire state, limiting the total amount of space for pot plants to about 4 football fields. Now the group will start looking at how they'll track the marijuana plants and test them, as well as figure out who can sell them. Altogether, it could take more than a year and a half to get this all figured out, all while patients who need it eagerly wait.
It does help pain, it does help nausea, it does help some of these conditions that a lot of people struggle with.
Why is it going to take so long for this industry to get up and running?
So there's a lot to be done.
The Dean of Pharmacy at Cedarville University says making sure this law is implemented right is very important.
It's easier to make good decisions on the upfront rather than changing bad decisions later.
He says there's a lot to be discussed considering the fact that marijuana is classified as illegal and not a medicine federally.
Even though it's been recognized as having medicinal value by the state of Ohio, the challenge really is where are the monitoring parameters?
Several Ohio cities are wondering the same thing. Towns like Troy, Beaver Creek, and Kettering all have temporary ordinances to ban grow sites or dispensaries within their limits, while this committee figures out the details. Community safety is top of mind.
And as a citizen, I have a concern.
Sheriff Lenhart is helping the group take on that issue. He tells 2 News Investigates he'll bring up law enforcement issues like pot crossing state borders and how to stop people from driving under the influence.
Opiums is a great example if things got out of control, and I think there has to be some control factors in this.
Now, we'll be keeping a close eye on the decisions made by this committee, and we'll keep you updated. Now, you're also encouraged to weigh in on the proposed rules. To find out how you can do that, go to our website at WDTN.com. I've also posted a timeline there that will let you know when we can expect these important decisions. Natalie Tyndall, 2 News Investigates.